Secretary Becerra, when Texas passed its highly restrictive abortion ban, President Biden promised a whole-of-government response, and in a statement yesterday, he said the administration will be ready when any ruling is issued. What can you tell us about the administration's plan for a whole-of-government response to defend the right to abortion?
Madam Chair, as I mentioned before, we are working at HHS through a reproductive health care task force that we established to make sure that we continue to protect the rights of women that exist today, those rights that exist today, to have access to care. We've expanded program services like Title X, and we will work with all of our partners throughout the federal government to make sure that every woman has the legal right to access the care that she's entitled to.
Well, I've been really alarmed that some Republicans have made it clear they don't intend to stop at abortion. Some saying the case that ruled against birth control bans was wrongly decided, and they've refused to increase funding for Title X program, which I've been talking about. That provides funding for birth control, cancer screening, life-saving care. And in fact, they voted to undermine that program just last week. Now, HHS approved but had to turn away dozens of highly qualified applicants for this program in March as a result of flat funding. Can you tell us what that means for patients?
First, I want to make note that because Congress was successful in passing its omnibus budget, we're going to be able to do far more than what the President's budget first proposed, because it was based on a baseline using the continuing resolution funding levels. So we will do much more working with you to make sure adequate funds are available for programs that provide women access to the care that she needs. We're also going to make sure that we speak to all those providers who are out there who have an obligation to make sure women are receiving the services they're entitled to. I yesterday spoke to a number of health plans, representatives of various health plans throughout the country, to make it clear that we intend to enforce the law when it comes to women accessing the care that they're entitled to.
Can you tell us how the proposed increase in HHS will expand access for women of color and low-income women?
We're working hard to make sure that we're addressing some of the maternal mortality and morbidity circumstances that we see in this country, where typically a woman in the Black community, in our Native populations, will suffer the consequences of lost birth, possibly a loss of life, in far greater numbers, probably 3 to 1 compared to in the white community. And so we are investing in the President's budget close to $500 million to increase our services in maternal health and mortality. We are also calling on states through the American Rescue Plan to increase the number of days that a woman is entitled to postpartum care from 60 days under Medicaid, to 365 days under Medicaid.
Okay, thank you. On another topic, I am really concerned that further delay in passing emergency COVID funding could undermine our hard-won progress. What are the immediate effects if Congress does not provide more funding for the COVID-19 response as soon as possible?
Madam Chair, thank you for that question. I've said this publicly many times. We have been first in line to receive vaccines, some of the therapeutics, the antiviral medications, because we have been at the beginning of the negotiations to have access to those therapies and drugs. Without the money to make the long-term commitment going forward, we can't assume that we will get first in line. Many other countries are already negotiating for access to those treatments. And what we need to do is plan ahead. We have a stock right now of vaccines and treatments that cover us for the next several months. But we can't say that if there's a new variant that hits, or if we need to buy the next generation vaccine, that we'll be the first in line if we don't have the money.
Meaning
now.
There's a limited supply and we won't have access to that supply unless we have the funds available now?
Correct.
Okay. Parents across the country are waiting anxiously for vaccines for young kids. I know FDA is working on this, but having safe, effective vaccines is the first step, and we need the administration to be ready to distribute enough doses and make it easy for parents to get them for their kids. Are you ready for that?
We're ready and anxious as you are. As you said, safe and effective are the key words. FDA will move when they have the data that reflects that they are safe and effective to use for those under 5 years of age. And we're already coordinating with a number of providers, including pediatricians, to make sure we're making those available as quickly as possible.
Do we have enough doses available once it's approved?
we will be able to purchase because we made a reservation of funds to make sure we could purchase. But once again, how much, how far, and what the vaccine might look like will determine whether or not we have access to the supply we need.
Secretary Becerra, I want to go back to a topic that Senator Sheen mentioned, and that is that our communities are really being hammered by the opioid crisis. Just last year, more than 105,000 Americans died from a drug overdose. In Washington state, synthetic opioid use is up drastically. Overdose deaths are now up 66% since 2019, and over half of those are attributable to fentanyl. This is just unacceptable. We really need some urgent action from the administration. Can you talk to us about what your plan is to stop the harm being caused by opioids, especially fentanyl?
Well, Madam Chair, in response to some of Senator Blunt's questions, I mentioned that we have reorganized within HHS to make it a priority to address drug use and address the disorder that is there, especially with opioid. So we have come up with a different strategy. We forget about the stigma, we forget about the old way of doing it, and our strategy now not only relies on prevention and treatment, but on harm reduction and follow-up services so that we don't let people regress. And so what we're doing right now is working with local communities, because we don't do it at the federal level. We work with local communities with the resources you all are giving us to help beef up their capacity to provide not just testing and treatment, but also to help them with harm reduction.
Well, I am especially alarmed by the rise in overdose deaths among adolescents. Fatal overdoses among youth nearly doubled in 2020 and have continued to rise since then, which appears to be driven by these counterfeit pills that are laced with fentanyl. Parents in my state want to know, what is the Biden administration doing to protect our kids and prevent young people from seeking out illicit drugs and make life-saving overdose reversal drugs more available?
Well, Senator, we broke through that ceiling that existed that prevented us from supporting local successful operations that, for example, let someone know if the drug they were about to take was laced with fentanyl. The bugaboo back then, the stigma was, oh, you're helping someone take drugs. We'd rather save a life than judge that person who's about to take a drug, because they will take the drug whether we try to help them or not. And so today the federal government will support those local programs that are, for example, providing fentanyl strips to people so they can test that drug that they may be about to use to find out if it's going to have a harmful...
Does that help adolescents?
That would help anyone who comes in and who has access to that service from that local provider.
And kids would seek that out?
Oh, Madam Chair, there's everyone, every walk of life, every age as well, who's coming to some of these centers. Now, some of these kids may require some adult authorization in order to take certain treatments, but fentanyl strips are available for those who are about to inject themselves or use a drug that is, again, could likely kill them.
And kids know about this?
I suspect many adolescents are aware of some of the local anti-drug programs that are available. I can't tell you I know if they make use of them directly or not, and I can't tell you what every state has in terms of laws and making some of these services available to those who are adolescents, but I do know that those programs are made available to those who have drug issues.
Okay. Well, let me just change the topic a little bit. The pandemic, as you know, has been really hard on our kids and has turned their lives upside down. So they've lost time at school, time with their friends. Some have lost loved ones, and they're dealing with a lot of stress and anxiety and trauma, and they really need our help. But even before the pandemic, I was hearing from parents who are frustrated by how hard it is to find mental health services for their kids. The president's budget would invest heavily in crisis care systems, which I agree are important to handle emergency situations and prevent tragic outcomes. But let me be clear, children should not have to wait until their mental health hits this crisis point to be able to get care. Parents are really desperate to get help for their children here. How would this budget, particularly your proposal allowing states to use 10% of their mental health block grant funding for prevention and early intervention programs, help with that?
Madam Chair, let me point out one particular program that I know you and Senator Blunt have worked hard on over the course of some time, and that is the Certified Community Behavioral Health Clinics and how we are planning to expand access to those. We provide about $250 million for the expansion of those services because we know that locally in the community, if a family, if a young person has access to those services, we get to them a lot sooner and perhaps save a life. And so we're going to try to expand that. The $51.7 billion 10-year investment that the President's making in mental health services is transformative. If you all pass that in the President's budget, we will be able to do far more in reaching these families because too many, as you said, don't have the access they need.
Okay. Thank you very much.